Welcome back, guys. This is Dr. Matt Sherwood again with Sherwood Spine and Sport here in Crown Point, Indiana. This is our last video of our low back with sciatica series, and this one we're going to be dealing with the true sciatica, where the sciatic nerve gets entrapped in the back of the hip. Symptoms present a little bit differently with this, so a lot of the time the pain is just often in the buttock. There may or may not be pain in the lower back. The pain will radiate down into the leg like the other cases. This one, on occasion, the thigh might not be affected at all. It just might be the butt, and then the pain or tingling will skip the thigh altogether, go below the knee into the shin, calf, or foot, as the sciatic nerve does not have any supply to the skin in the thigh, interestingly enough. I feel as if this is the hardest presentation to treat for a variety of reasons. First, it can be the sciatic nerve in individuals can be anatomically variant. So most people, the sciatic nerve is a thick nerve about the size of your own index finger, and it runs underneath the piriformis muscle, which is a small pear-shaped muscle deep in the back of the hip. And that's the typical course. It runs underneath that muscle, proceeds down the leg. There's other individuals where the nerve will actually bifurcate or split and wrap around the piriformis. And then there's another subset of people where the nerve directly pierces the piriformis, goes through the middle of it, and they're going to be particularly prone to have that nerve entrapped in the muscle. The other reason is you can have the entrapment in the back if your hip and pelvis are too tight. And you can also have it if there's too much mobility. So people that are very flexible, hypermobile, they can also have this presentation. So that's what makes it tough. It's really, you have to base your treatment depending on the anatomy of the individual, tightness, so on and so forth. So first off, what would we do in the office for this? We would do a very thorough evaluation. So we're gonna check how well the spine moves, how well the pelvis moves. We're gonna check all the different ranges of the hip, see if any of these are limited, if there's too much mobility. We're gonna check the ankle and the foot. Is there restrictions in the joints in the ankle and the foot, or is the foot also hypermobile? So that's where we're gonna start with. The treatment options, it's gonna depend on what we find for the evaluation, but oftentimes we're doing dry needling into the muscles in the back of the hip. We're of course doing our spinal adjustments if there is indeed joint restriction or joint stiffness, low back and pelvis. Adjust the hip if that needs to be done, adjust the ankle and the foot if that needs to be done. And then the other part is going over proper exercises and or stretches for home. Oftentimes we're gonna be doing work on the sciatic nerve itself, so holding the piriformis or the other muscles in place, pulling the nerve through there, getting it moving better. And then there's also, you can be doing that at home as well. So what we'll go over next is I'm gonna go over 2 exercises which I feel are most therapeutic, that I use very frequently, and it can be applied for the individual that's really stiff or the person that's a little bit on the mobile side. So that's what we'll go over next here. All right, so this first exercise we're gonna go over here is, it's called a pigeon pose in yoga actually, but this is gonna be great. We're gonna modify it a little bit, and this is good for the individual that's both tight and hypermobile or too flexible, okay? So how we're gonna do this is, we always want to start in all fours, so we start from a stable position. The leg we're stretching is going to go in front. So I'm just going to show you my right leg just because of where the camera is. We're going to move this right knee up. You do not have to have this front knee in a figure 4 position because you can irritate your knee or your hip. We just want the knee lined up with the shoulder. We don't want it too far in. And then we're going to walk the back foot back until we get a really nice pull in the back of that hip there. Now you can actually, if you're tight, you can just hold this position for about a minute. What I like to do typically is turn it into a little bit more of a strengthening exercise or something to activate the glutes. And this is where it would be more beneficial for the flexible individual. So what we're gonna do is we're gonna push our right knee and shin down into the mat. Minimal support on our hands because we want to be using our glute, and then we're going to lift up about till this is about 90 degrees here, and then we're going to slowly sink back to the start position. You shouldn't be pushing down with these hands too much because then you're just using your arms. We're trying to get the hip going here. So I like to go on fingertips sometimes, push that leg down and lift up to about 90 degrees and then slowly back. There should be a really big burn in here. and that's gonna really increase our external rotation of the hip. It's gonna activate our muscles, and it's gonna loosen up the muscles in the back of the hip. Usually about 10 to 15 reps of that, and you can do that 2 or 3 times a day. I'll turn real quick. I just wanna point out that a lot of the times when people show me how they're doing the pigeon, we wanna make sure that our back is not completely twisted over here. When the hip gets real tight and we sink back, we're gonna rotate and fall away. We need to make sure we're staying nice and flush here and flat, so you may need someone to kind of help you with that initially. The next thing I'm gonna show you is a stretch for the sciatic nerve itself, or the sciatic nerve flossing, we would call it. You can typically do this in your bed. I'm just gonna show you on the floor so I don't have to keep moving my camera around in here, as we're a little limited with space. So you're gonna lie on the side up that is the sciatic nerve is affected. So once again, I'll show you on my right side. Lay here, head supported with a pillow or your arm. We're gonna tilt the head back to get some slack through the spine. We're gonna straighten the top knee, and then we're gonna point our foot and toes up toward our head. Relax the foot, bring the knee back, and then we're gonna go down with the chin toward the chest. And then we just repeat. So back, straighten the knee, point the foot up, get a nice pull, relax there, and down. The right leg can stay resting on top of the other leg. I lifted it a bit just so you could see it better. You do not hold that stretch, because we don't want to be pulling on that sciatic nerve when it's having an issue for a prolonged period of time. So you bring it up, point, bring it right back down. You do 15 reps of that 2 times a day. If it doesn't seem like the symptoms are aggravated following that, then you can do it actually up to 5 times a day, and that's therapeutic as well. All right, so that concludes our last video of our low back with sciatic series for the True Sciatica. If you guys have questions about those, any comments, anything, type it down below. And I hope you guys got something out of these videos. Have a good one.